Can you identify the landmarks on the sacrum? Most students get this wrong. This is Anatomy Made Easy with Ekechukwu Dora Ozioma. If you have not followed, liked, or subscribed to all our various social media pages, please do so. You can find us on TikTok, Anatomy Made Easy. On YouTube channel, we have our Anatomy Made Easy also on YouTube, and WhatsApp channel, Anatomy Made Easy. Please do not forget to share this video. Today we're looking at the posterior view of the sacrum, an essential landmark in anatomy and clinical practice. Look at this here. This is the median sacral crest. They are the fused spinous processes of the sacrum. It's important as a landmark for lumbar punctures and sacral procedures. On each side of these median sacral crests, here you see the intermediate sacral crests. These are formed by the fused articular processes of the sacrum. They are useful in identifying vertebral articulation points. Further out here is the lateral sacral crests. They are formed from the fused transverse processes of the sacrum. Clinically, they help orient pelvic surgery landmarks. Now here is the posterior sacral foramina. This allows the dorsal rami of sacral nerves to pass. It is very important for understanding nerve blocks or sacral pain pathways. This is the sacral canal. It runs through the sacrum and ends at the sacral hiatus here. The sacral canal clinically is the passageway for epidural anesthesia in adults and children. And here is the sacral hiatus, the inferior opening of the sacral canal. It is a landmark for caudal epidural injections. Here on the sacrum is the auricular surface, on the posterior surface of the sacrum. On each side, it articulates with the ilium to form the sacroiliac joint. That's the joint that bears weight from the spine to the pelvis. And this is the superior articular facets. These facets articulate with the inferior articular facets of lumbar vertebra 5, stabilizing the lumbosacral joint. And here, finally, is the sacral conum. This is a small projection on either side of the sacral hiatus. It's very important landmark for caudal epidural needle insertion. Do not forget, this is Anatomy Made Easy with Ekechukwu Dora. And here we have learned about the median, intermediate, and lateral crests, posterior sacral foramina, sacral canal, and sacral hiatus, the auricular surfaces, superior articular facets, and sacral conum. These landmarks are essential for nerve blocks, epidural sacroiliac joint procedures, and surgical orientation. Stay tuned with Anatomy Made Easy, and please do tell me, which of these landmarks do you always miss up or forget? Comment below and let's talk about it. Stay tuned with Anatomy Made Easy. Ekechukwu Dora Ozioma. Bye-bye.